Bismillahirrahmanirrahim. Today, I will be presenting a topic of UNDP and UNFPA. My name is Dr. Temia Yu, and my supervisor is Professor Dr. Saira Afzal. So, we will start with quote of the day, uh, which is by Confucius, which says, "Our greatest glory is not in never failing, but in rising every time we fall." Outline. So this is the outline of my presentation today. It includes, first of all, we will discuss United Nations Development Program, and then it will include introduction, history of UNDP, organizational structure, its strategic plan, and how it works in Pakistan. Then we will discuss UNFPA with the same layout, in which we will discuss introduction, background, how UNFPA works, key areas, achievements, and how it works in Pakistan. And we will end today's presentation with multiple choice questions. So these are the learning objectives of today's lecture, which include to understand the role and significance of United Nations Development Program and the United Nations Population Fund. They explore their history, mission, and organizational structure, identify key focus areas, and then examine their role in Pakistan. And we will do discussion about their work and its impact in Pakistan, including their partnerships. And then we will evaluate the latest updates, achievements, and collaboration of both UNDP and UNFPA. So we will start with United Nations Development Program, also known as UNDP. Introduction. UNDP is based at the headquarters of United Nations in New York City. It is the largest UN development aid agency. It has offices in 177 countries. The UNDP is funded entirely by voluntary contributions from UN member states. The United Nations Development Programme is the UN Global Development Network advocating for sustainable development, poverty reduction, and human rights. It was established in 1965. It operates in 170 plus countries and territories to support local governments in achieving SDGs. These are the SDGs, which is also called as Sustainable Developmental Goals. These are basically 17 goals which have been set by all the countries in the United Nations, and they are to be achieved by 2030. They include no poverty, zero hunger, good health and well-being, which is the most important. Number 3 SDG from health perspective. History of UNDP formation. UNDP was established on 22nd November 1965 by merging two UN bodies, the Expanded Program of Technical Assistance (EPTA) and the Special Fund. The rationale behind was to avoid duplication of both of their activities. So the mission statement. UNDP is concentrated on three main focus areas: sustainable development, democratic governance and peace building, climate and disaster resilience. UNDP helps countries attract and use aid effectively. In all of their activities, they promote gender equality and protection of human rights. So this is the organizational chart of UNDP. It looks a bit confusing and too much information, but we will start with the main highlighted points, which are the main points to be remembered, keeping Pakistan in perspective. So this is the administrator, which is Ashim Steiner, and then he has two associate administrator and other people in his office. And then he looks over the regional offices. So they have Regional Bureau for Africa, Regional Bureau for Asia and the Pacific, Regional Bureau for Arab States, Regional Bureau for Europe and the CIS, Regional Bureau for Latin America and the Caribbean. Pakistan falls into the Regional Bureau for Asia and the Pacific, and its regional hub is located in Bangkok, and then they have country office in Pakistan. So on the left side, we have Ashim Steiner, who is the current administrator of United Nations Development Program. Then we have Kanni Vignaraja, who is the Regional Bureau for the Asia and the Pacific. And then we have Samuel Risk, who is the UNDP representative of Pakistan. So this picture here shows the main working of the UNDP. And I think this is the crux of UNDP, which it offers, what is its strategic plan. So we will concentrate on all the parts which are shown in this picture. So on the left side, there are 6 components, and then there are 3 enablers, and then they have 3 main goals. And the ultimate agenda is always to achieve 2030 SDG goals. So this circle here represents all the 17 goals of SDG. So now we will describe this diagram one by one. So UNDP supports countries towards 3 directions of change. So these are the main 3 directions of change. Number one is the structural transformation, which includes green, inclusive, and digital transition, working with countries beyond solving immediate development challenges to supporting change in the underlying system and the structures that shape a country's development. Then, leaving nobody behind. A right based approach centered on empowerment, inclusion, equity, human agency, and human development capabilities, which recognizes that poverty and inequality are multidimensional. And finally, building resilience, strengthening the capacity of countries, institutions, and people to prevent, mitigate, and respond to diverse risks, including crisis, conflict, natural disaster, climate, and social and economic shocks. So, this strategic plan then describes the work of UNDP through 6 signature solutions. These include to overcome poverty and inequality, governance, resilience, environment, energy, and gender equality. And then all this work should be enhanced by 3 enablers, which include strategic innovation, digitalization, and development with financing. So, strategic innovation include empowering government and communities to enhance the performance of the entire systems, making them adaptive and resilient. Digitalization, supporting countries to build inclusive, ethical, and sustainable digital societies. And finally, development financing, partnering with governments and the private sectors and other partners to align public finance and private capital flows with the SDGs and mobile finance at scale. Now we come to the work of UNDP in Pakistan. The United Nations Development Programme Pakistan is a key development partner of the Government of Pakistan, working to eradicate poverty, promote sustainable development, and strengthen governance institutions. It collaborates with the government, civil society, and international organizations to achieve Pakistan's development goal in line with the UN Sustainable Development Goal. So the key focus areas of UNDP Pakistan include governance and institutional, climate change and environment, economic development and poverty, gender equality and women's rights, crisis prevention and recovery. So major initiatives and programs currently being done by UNDP Pakistan include Pakistan National Human Development Report provides data-driven insights on human development issues like inequality and youth empowerment. Glacial Lake Outburst Floods Project focuses on mitigating the impact of climate change in northern Pakistan. Youth Development Program helps young people gain skills, employment opportunities, and leadership roles. Accelerator Labs uses innovation to tackle complex development challenges. Partnership, Partnerships and collaboration. UNDP Pakistan collaborates with Government of Pakistan at federal and provincial levels, international donors like USAID, DFID, and the European Union, and then private sectors to drive sustainable development projects. So we are going to discuss some of the latest updates available at the UNDP. These are the quick youth facts which were recently published by UNDP Pakistan. It shows we will focus on a few of them. For example, that in Pakistan's future, 48% feel it will be brighter, 16% feel it will not change, and 36% feel it will be bleak. And for literacy, 70% are literate and 30% are illiterate. Quality of life, 67% of the youth feels that their life is better than their parents, 18% feels it's the same, and 15% feels worse off. And then we have some facts about education, that 16% have 1 to 5 years of education acquired, 40% have 6 to 10 years of education acquired. 9% have 11 to 12 years of education acquired. 6% have more than 12 years of education acquired, and so on. This report was published on 13th March 2024, and it shows Pakistan level of human development classification. Pakistan Human Development Summary capturing achievements in the HDI and complementary metrics that take into account gender gaps, inequality, planetary pressures, and multidimensional poverty. Unfortunately, it shows that Pakistan has human development as low. HDI value is 0.54, and the developing region is South Asia. So you can see that we are in the low category, which is the worst category, unfortunately, to have. So this was all about UNDP. Now we comes to United Nations Population Fund, also known as UNFPA. The United Nations Population Fund, formerly the United Nations Fund for Population Activities, is a UN agency aimed at improving reproductive and maternal health worldwide. It works in over 150 countries to promote maternal health, family planning, and gender equality. It has headquarters in New York City, USA. Background: in December 1966, 12 heads of state made a declaration urging the UN to work on population issues. In 1967, the Secretary General created a trust fund for population. In 1969, this agency began its work, and it was known as United Nations Fund for Population Activities. In 1971, it was placed under the authority of UN General Assembly. In 1987, the name was changed into United Nations Population Fund. However, the shortened term of UNFPA has been retained. So this is on the left side, this is Dr. Natalia Kanem, which is the current executive director of UNFPA. On right side, we have Dr. Nafis Sadiq, who was the former executive director working in UNFPA from 1987 to 2000, and she was from Pakistan, and she was in charge of UNFPA activities all around the world. So that is one of the highest levels of UN offices occupied by any Pakistani. So the mission statement of UNFPA states, our mission is to deliver a world where every pregnancy is wanted, every childbirth is safe, and every young person's potential is fulfilled. These are three transformative results, or which are known as goals of UNFPA, which are to be achieved by 2030 in alignment with SDGs. Number 1, ending unmet need for family planning. Number 2, ending preventable maternal deaths. Number 3, ending gender-based violence and harmful practices. In ending unmet need for family planning, zero unmet need for family planning, they say that we are the world's single largest provider of donated contraceptive to developing countries, and our programs increase the availability of contraceptives and dismantle barriers to services. Then, ending preventable maternal death. UNFPA strongly believes in helping to strengthen the health system, train and educate health workers and midwives, and improve access to a full range of reproductive health services. And in the end, they believe about ending gender-based violence and harmful practices. They say that we work with policymakers, justice systems, and health systems and engage men and boys to advance gender equality. We protect survivors of gender-based violence by providing a combination of essential services, including in humanitarian crisis. So now we come to how UNFPA works. Number 1, it provides technical and financial assistance to countries. Number 2, it supports governments in implementing reproductive health and population policies. Number 3, works with NGOs, civil society, and the private sector. And lastly, focuses on data collection and research to inform policies. These are key areas of work for UNFPA. Number 1, reproductive health and rights, access to contraception, maternal care, and sexual education. Population and development, data collection and analysis for policy planning. Gender equality, ending gender-based violence and promoting women's rights. And lastly, humanitarian response, supporting health services in crisis and conflict zones. These are some of the achievements of UNFPA. They have assisted in reducing maternal mortality worldwide, helped millions of women gain access to contraception, supported policies and programs to prevent gender-based violence. So now we come to the role of UNFPA in Pakistan. UNFPA Pakistan is a key partner in promoting reproductive health and rights in the country. It works to improve maternal health, gender equality, and family planning services. It collaborates with the government of Pakistan, NGOs, and international organizations. On the right side, we have Dr. Lue Shabane, who is the current country representative of UNFPA Pakistan. These are the key areas of work in Pakistan, which include maternal and newborn health, improving healthcare facilities and training medical staff, family planning, by expanding access to contraceptive and reproductive health education, engagement of youth by providing sexual and reproductive health education to young people, gender equality, combating gender-based violence and harmful practices, and then humanitarian response, supporting reproductive health services in crisis situations. This is an image taken from the UNFPA Pakistan website. As you can see, it has a girl, and the message which she's showing is in Urdu. And this was the key message at one of their home pages at UNFPA website, which says that सनफी तशद्दुद नामुनासिब तबसरों और लतीफ़ों के खिलाफ आवाज़ उठाएं. It is about their current strategy to overcome digital gender-based violence. Key results of UNFPA Pakistan include midwifery curricula at international standards, population projections, and minimal initial service package. Now we will discuss few latest updates of UNFPA. This is a statement which was published last week on 21st February 2025. It is regarding sexual violence perpetrated against women and girls in the Eastern Democratic Republic of Congo. As you can see, it shows that nearly 500 reported cases of sexual violence were reported within a single week in the Goma area, including more than 150 involving children. This number likely represents only a fraction of actual survivors. Those managed to reach care, with many more unable to due to services being cut off, fear of retaliation from perpetrators, or stigma in their community. This is another statement which was published on 6 February 2025, which is the International Day of Zero Tolerance for Female Genital Mutilation. Female genital mutilation violates fundamental human rights and can result in complications from detrimental physical and psychological as well as social and economic sorry, impacts lasting throughout childhood, reproductive years, and old age. Today, over 230 million girls and women worldwide are FGM survivors. The stakes are high. An estimated 27 million additional girls are at risk of undergoing FGM or female genital mutilation in the next 5 years. Now we come to the multiple choice questions of part of my presentation. So the first MCQ is the UNDP focuses on three main areas. Which of the following is not one of them? A. Sustainable development. B. Democratic governance and peace building. C. Climate and disaster resilience. D. Military intervention in conflict zones. E. Gender equality and human rights protection.
D.
Yes, the answer is D.
D.
Yes, it doesn't include military intervention in conflict zones. MCQ number 2. A newly appointed government official in Pakistan wants to develop policies to empower youth and reduce inequality. Which UNDP initiative should they refer to? A. Glacial Lake Outburst Floods Project, Pakistan National Human Development Project. Number C. Climate Change Resilience Program. D. UN Peacekeeping Operation. Or E. Disaster Recovery and Rehabilitation Fund.
B.
Yes, B. Pakistan National Human Development. Okay, now we come to 3 MCQ. UNDP collaborates with various entities to implement its program. Which of the following is not a key UNDP partner? A. Government of Punjab. B. International donors such as USAID and DFID. C. Private sector organizations. D. Tobacco industry. Or E. European Union.
D.
The, yes, the answer is D. Tobacco industry. Yeah. Okay, so now we come to MCQ number 4. A devastating flood has affected thousands of families in northern Pakistan. Many displaced women and girls face limited access to healthcare, sanitation, and protection from gender based violence in temporary camps. A humanitarian organization is seeking UN agency support to provide maternal health services, psychological counseling, and disaster resilience strategies for the affected communities. Which approach would be the most comprehensive solution for this situation? A. Only involve UNDP to focus on rebuilding homes and restoring the infrastructure. B. Only involve UNFPA to provide reproductive health care and gender based violence support. C. Collaborate with both UNDP and UNFPA to ensure a holistic approach addressing both disaster resilience and women's health. D. Rely solely on the government of Pakistan without UN intervention. Or E. Request assistance from UNESCO as they focus on humanitarian aid in disaster situations.
C.
Yes,
I
C
guess
is the right answer. Answer to collaborate with both UNDP and UNFPA to ensure a holistic approach. MCQ number 5. The United Nations Population Fund UNFPA focuses on improving A. Military defense strategies. B. Reproductive and maternal health. C. Space exploration program. D. Agricultural development only. Or E. Global trade regulation.
B.
Yes, reproductive and maternal health. MCQ number 6. UNFPA aims to achieve 3 transformative results by 2030. Which of the following is one of them? A. Ensuring universal health coverage. B. Ending preventable maternal deaths. C. Increasing global food production. D. Reducing dependency on artificial intelligence. Or E. Developing cancer registry and resources. The answer is B. Ending preventable
E.
maternal death. B is the answer. Then we come to MCQ number 7. A rural health worker in Pakistan is struggling with limited access to reproductive health services for women. Which UN agency's initiative would best support their needs? A. UNESCO. B. UNHCR. C. UNFPA. D. WHO. Or E. UNICEF.
C.
Yes, it's UNFPA. MCQ number 8. A government official in Pakistan is designing a gender responsive disaster recovery plan. Which UN agency or agencies should they collaborate with? A. UNDP only. B. UNFPA only. C. Both UNDP and UNFPA. Number D. UNESCO and WHO. Or E. None of the above.
C.
Yes, it is both UNDP and UNFPA. A young entrepreneur in Pakistan wants to develop a business focused on sustainable development and youth empowerment. Which UNDP or UNFPA program could provide support? A. UNDP Accelerator Labs. B. UNDP Climate Resilience Program. C. UNFPA Maternal Health Project. D. UNDP Emergency Response Fund. Or E. None of the above. It
E.
is A. UNDP Accelerator Labs. They can help in developing business for the local population. Now we come to MCQ number 10. Both UNDP and UNFPA align their programs with the UN SDG Which of the following SDGs is directly linked to UNFPA's mission? A. SDG 1, no poverty. B. SDG 3, good health and well-being. C. SDG 7, affordable and clean energy. Or D. SDG 9, industry, innovation and infrastructure. Or E. SDG 14, life below water.
SDG 3.
Yes, it's B. SDG 3, good health and well-being. This is the MCQ key. This is the YouTube channel where my video will be uploaded. And thank you very much listening to me. Thank you.